I'm here to talk to you about oxidative medicine. Dr. Ron said that was the theme of the conference, and I thought, wow, that's a pretty big topic. So I thought I'd try to make connections. I grew up in a Greek family, a big Greek family that's here in Wichita, part of them. And my dad always taught me to ask why. And he would play a game with me when I was little, Ask Dr. Science. So I could ask him anything, and he would come up with some science scenario, and I'd try to think through it. It was pretty fun, but I think asking why has protected me quite a bit through medical school. I loved biochemistry in college, and that's really why I decided to go to medical school, because I thought I could apply it and have a connection with people at the same time and see healing going on. And when I got to medical school, I found that the approach was not everything I thought it would be. I kept asking why, and I wasn't getting the answers, and so I didn't give up on it, and that's really how I ended up in integrative medicine. I was a first and second year medical student in Kansas City, and then I came to Wichita for my third and fourth years because my parents were here, and I wanted to be closer to them. And I saw people dying in the VA system. I was rotating through the VA system, and I thought, boy, this is depressing. This is not exactly what I came in for. And I had a friend who's actually here today, Jackie, who her husband, I don't know if you mind if I tell the story, but her husband was sick and had a form of cancer that had spread from skin to other places, and really didn't have a lot of options. And she took him to the Riordan Clinic. And while I was in medical school here, rotating through clinical rotations, I saw Justin get better while the patients I was caring for got worse. And so I thought, well, this is interesting. So I went to the dean of the medical school. He was a tall guy, about yay high, and in my little white coat, and I went, hi. I explained the story to him, and I said, I want to go shadow. You know, there's something here. I know it's a black box, but there's something here. If this one got better when all the others are dying, there's something that needs to be found. So they told me, absolutely not as a medical student. So I said, I'll go on my own time. So I came to shadow, and I met with Dr. Ron and Dr. Jackson and Dr. Kirby at the time, and I sat in on chart review. And Dr. Jackson, as soon as I walked in the door, said, give me some urine, let's take a look at you. But these are my kind of people. So I gave my urine, and we looked at that, and then I sat down on chart review, and I shadowed on patients. I thought, this is not rocket science, it's not voodoo, it's not magic, it's not, harming people. What it is really looking in places where others have not looked or have overlooked, and asking the question, why? So that's kind of how I got here. I did a fellowship. Well, at that point I was in medical school, and I knew I had to finish and kind of get my ticket, and that was rough, kind of being enlightened early on and knowing I had to go through the rest. So I went to internal medicine residency at KU because I thought, well, they do some questioning, and I thought that would be maybe a forum where I could continue asking why and find root causes for things. So I finished that, and there happened to be a fellowship at KU, Dr. Jeannie Driscoll, who actually trained with Dr. Riordan and Dr. Hunning-Hockey. And so my training in integrative medicine, I think, was unique in that there was an orthomolecular thread through it, which most programs, the Institute for Functional Medicine, I don't think they have as much of that orthomolecular concept, but it's a valuable one in finding underlying causes. So I enjoyed my time at the university in the academic center in integrative medicine, but I felt like there was more that I could do for people, and my hands were a little bit tied, so that's why I decided to make the transition this past year to the Riordan Clinic, and I feel like it's been a good fit. So that's a little bit about me. I have a husband, Chris, and a 2-year-old Romanos who are back in Kansas City, and I'm so happy to be here with you all. It's wonderful to see so many people interested in this, in medicine, and spreading the knowledge. So today we're going to talk about oxidative medicine, and that's a pretty big topic. We've talked a lot about vitamin C. I think Dr. Taxman's talk was a wonderful introduction to this, because I completely agree. The GI is where it is. You've got to start with the GI tract. There's actually a bacteria that was found recently, Corynebacterium glucurolyticum, that's been found to make vitamin C. We can have this in our GI tract. So we can make it externally manufactured, and we can make it externally in our gut, believe it or not, now too. The research on the microbiome is exploding. we're finding things out that we've never known before. And if you consider that the majority of research up to this point has taken place in a sterile environment, we have no idea. We have no idea. Only the human studies can somewhat represent, but there's so much communication going on between the microbes in our body in a helpful way, we'll see, that all of research, I think, is going to do a 180. So we're just at that tipping point. All right. Make sure I can use this. So I'm a big picture kind of person. I like to fill in gaps where they exist, and I think we need to be honest, and if we don't know, we need to ask why, and if there's not literature behind it, we need to do the research. I think, Dr. Nina, it's wonderful that you've continued to do research all these years in the basic sciences and some humans. We need everyone doing that, and we need to continue to educate ourselves because we don't know it all. So today we're going to talk about reactive oxygen species, reactive nitrogen species, and their roles in inflammation, detoxification, communication, and then at the end I'll show you a little bit of clinical applications, some of the labs we get and how to interpret those, in case some of you might have gotten some labs on yourself or in the future. As we talk about this, I think being Greek, one of the sayings that I've heard over my childhood many times is everything in moderation, everything in moderation. My old grandparents from Greece, everything in moderation. Just remember that, little one, as you grow up. And I think they're right, honestly. I think on one hand we have pro-oxidants. High-dose vitamin C IV is pro-oxidative. Oral vitamin C tends to be antioxidative. So how can it be, is it good and bad? I think that everything in moderation, everything has its place. Chemotherapy, pro-oxidative. Radiation, pro-oxidative. Some antibiotics, pro-oxidative. Interesting. Glutathione in the detoxification system, very antioxidative. So I think, remember this concept that there's not necessarily good and bad, but we need both. So, and why do we need both? We need both for balance. Really, the body operates at a condition of homeostasis, maintaining stability and balance in the cell, in the body, in the mind, and the heart. We see this every day with water balance. You have to stay hydrated. Too much will kill us, not enough will kill us. Temperature, we operate in a narrow temperature range as humans. The blood pH, 7.0 to 7.4, really? That's pretty tight. Blood sugar balance. Blood pressure, ion balance, and then we'll take it a step farther and look at redox balance, which I think is really, really controlling what the cell is doing and why. Over here, Saint Seraphim of Sarov, he said, acquire a spirit of peace and thousands around you will be saved. So internally, in this field especially, I think sometimes we get attacked for what we do and feel the need to defend things, but really if we let the medicine speak for itself, if people are being healed, we don't have to advertise anything. More people just keep coming. So internally, if we're peaceful, there's no need to defend anything. We have the literature to prove it. We do the research, but just remember, internally, if you're peaceful, many around you will be peaceful and be helped. And that's really homeostasis. St. Seraphim, they say he would feed the wild animals. He was so peaceful. The bears would come and eat out of his hand. It's pretty amazing. Okay, so some definitions. Stress. Hans Sale, you'll find him in the nursing literature more than anything, I think. Nursing textbooks often mention the stress response, and Dr. Sale, who described it, the fight or flight, and the autonomic nervous system, which is really the master controller for the body. You have the sympathetic nervous system, which controls that fight or flight response. If a bear's chasing you or a lion's chasing you, you're going to run. You're going to empty your bowels real quick. You're going to shunt blood to your periphery, to your muscles so you can run. You're going to deep breathe, and you're going to go. And then on the other hand is the parasympathetic nervous system, and that's the controller for resting, sleep, digestion, clearly what the majority of patients don't have enough of, right? Healing goes on during that parasympathetic time. On exam, sometimes I'll check people's pupils. That's one way you can kind of get a glimpse of their autonomic nervous system balance. Temperature is also different temperature points on the body, but if you look at the pupils and shine the light at the pupils, hold the light there, you should see the pupillary response. You should see them constrict because the light's there, and they should stay constricted while the light's there. But oftentimes you'll see them constrict and then they'll open back up while the light's still there. And that's clearly sympathetic tone doing that. So that's one place in the body. If on clinical exam, you can see sympathetic and parasympathetic innervation of those pupillary muscles. Oftentimes they'll be sympathetic dominant. So Sale describes stress, acute stress, fight or flight, that sympathetic side. Chronic stress can have an effect on the immune system, we know from the literature. There can be good stress too, marriage, promotions, babies, graduations, and distress. I took my 2-year-old to the Kansas City Aquarium not too long ago, and we saw the pufferfish, and he didn't look too good. And I asked the aquarium attendant, I said, what happened to him? He said, oh, he had one of his episodes where he puffed up, he was scared, and I said, doesn't he just come back to normal? He said, oh, no, it's a very stressful time for them. Actually, when they encounter a threat and think they're going to die is the only time that they will puff up. And when they do it, they shunt water into their organs. So they have massive edema of seawater into their organs. They're kind of placed in critical care in the aquarium for 24 hours because oftentimes they'll die. So it's quite a stress, and it's not to be taken lightly. But our bodies do have that as well. I will watch my time, so I'll give you time to ask questions. So some other definitions: oxidative stress. Again, life is a balance between free radicals and antioxidants, not necessarily good or bad, it's just a matter of dose. Animals need oxygen to convert energy efficiently, we know this. Oxygen is a toxic mutagenic gas, believe it or not. So the way we've dealt with this, we need it for our metabolism, for energy, but we have an antioxidant system protecting us at the same time. Other definitions, just basics. Oxidized means a loss of electrons, currently in medical literature. Reduction means a gain of electrons. Leo says Gur from chemistry, if you remember way back when. Loss of electrons oxidized, gain of electrons reduced, that's what that stands for. So as we're using different language, that might help you on a basic level. St. Georgi, if you read his original works, he even questioned if this was true. He said, that a transfer of electrons always happens in a pair, which is fascinating. He said that our current, he probably would not agree with our current definitions of oxidation and reduction. And I think physicists will be, really honing this further in the literature as time goes on. Other definitions: free radical is defined as an atom or group of atoms that has one or more unpaired electrons. So they want to fill that space, they want to, so that's why they're reactive. They're always trying to fill that space and get another electron. Antioxidants are substances that inhibit oxidation reactions promoted by oxygen. Peroxides are free radicals, so oftentimes they'll donate electrons, as an example. Oxidative stress is an imbalance between the production of free radicals and the antioxidants that encounter them. So if we have too many unpaired electrons, too many free radicals, then that's considered reactive, and we can start breaking down cellular membranes or internal components. Over here on the right-hand side, endogenous sources of excessive free radicals. Make sure I use this correctly. Okay, so mitochondrial leak is one of those. When we eat, have you ever asked the question, why do we eat? I mean, really, if you trace back the food chain, you've got the sun that are making the plants grow. The plants have chlorophyll to acquire energy and store that energy and use it to grow a structure. We eat the plants, or the animals eat the plants, and then we eat the animals to acquire energy. And in that process of metabolism, we're actually generating free radicals. Mitochondrial leak. We actually generate oxidative stress by eating. I think I was talking to Dr. Humphreys too last night. I think that's one of the benefits of fasting or intermittent fasting, is actually decreasing inflammation by decreasing oxidative stress. Not to say that we should go to extremes with fasting, but I think fasting has a powerful tool in it, and it's free, which is helpful for people. So mitochondrial leak. Mitochondrial leak is one source. Enzyme reactions, auto-oxidation reactions. So we get free radical production. We can also get it from environmental sources, cigarette smoke, which is why we can't get those vitamin C levels up in those smokers. There's just so much oxidative stress and free radicals going on. We've got to use huge doses in them. Pollutants can do it, UV light can do it, ionizing radiation, xenobiotics. So we generate these free radicals. What are they really? Superoxide, you'll hear, unpaired electron and oxygen. H2O2 can undergo reactions and generate hydroxyl radical, which is a very reactive species. And what facilitates this or speeds it up are the transition metals, iron and copper, because they can go from a 2+ to a 3+ state, and they themselves can be oxidized or reduced. So when we have these unpaired electrons, basically, in species, then we can get peroxidation of lipids. So where we start to break down our cell membranes, for example, we can actually modify DNA bases, direct damage to the DNA, or proteins as well, and then we get tissue damage on a larger scale. All right, other definitions. I think somewhere in the talk about oxidative medicine, we have to mention NRF2, because if you read the medical literature, you'll be encountering it more and more. And even in the lay literature now, and supplements are talking about it left and right. And again, I think there's good here, but you have to understand it in context. NRF2 is a nuclear factor erythroid derived 2. It's basically a protein within cells of the body, and it requires an activator to release it from its bound protein. And then what it does is it goes to the DNA at an antioxidant response element, and that's the master regulator for antioxidant systems. So if you want to turn on glutathione production, if you want to turn on any antioxidant production on a massive scale in the cell, this is how you do it. So NRF2 can be activated or sent to the nucleus to turn on all the genes for antioxidants by foods. And interestingly, the bioflavonoids, the colors in foods, do this exceptionally well. Other things that do it, curcumin, you probably all heard about curcumin as an anti-inflammatory. This is probably one of the major mechanisms of how curcumin is an anti-inflammatory. The colors in foods, kale, grape seeds, blue corn, lots of examples. Coffee, which many of you are probably sipping on now. NRF2 activators. Interestingly, with NRF2, NRF2 in the literature in short bursts is activating antioxidant mechanisms and is helpful for decreasing inflammation, oxidative stress in the cell. If NRF2 is allowed to be activated for prolonged periods, it can actually be promoting tumor formation. So again, everything in moderation, right? When you look at NRF2, boy, this is just a little tricky pointer. Okay. So if you have oxidative stress going on, then that will signal this protein KEAP1 to release NRF2 and go to the nucleus, bind to the DNA, and start all the antioxidant cascades for the cell. So again, we'll ask why later. Why? Big picture. Just to give you a little bit more of how cells respond to oxidative stress. So you have a resting cell, and that cell should be highly reduced. So it should have lots of electrons or lots of energy in that cell at a resting state. We also see this in physiology. If you look in basic textbooks, the resting potential of cells should be negative, negative 90 millivolts or so. And that's because it should be reduced or have plenty of electrons. What we see in disease is that there's a deficiency of electrons or energy at baseline, so the cell's starting off more oxidized to begin with. And interestingly, the most reduced part of the cell, the part of the cell with the most energy or electrons, should be the mitochondria. And mitochondria, phylogenetically, if you look over time and in the literature, we believe that they came from bacteria, that there are actually bacteria in every one of our cells. And it's very interesting, we'll see later, that they communicate with the bacteria in the gut and other parts of the body. So how cells respond to oxidative stress: the cell should be highly reduced at baseline. It encounters oxidative stress from those toxins or even metabolism that we talked about earlier. And then oxidative damage can occur, calcium is released in the cell, and then hopefully we activate that NRF2 response to help protect the cell as that's going on, but that could fail. Activation may not happen if NRF2 is inhibited. We can get more oxidative damage to the mitochondria, more calcium release, and then we can damage the DNA with too much stress. So that's basically the pathway. So then you ask the question, well, why do we have oxidative stress in the cell at all? I think infections are a big part of that, and we'll talk about that. This is a paper. I just tried to throw in a couple here for if you're interested, you can look them up later too, but basically talking about the fact that we need oxygen for metabolism and for energy production on a higher level, especially with our brain size. And we've adapted antioxidant mechanisms to help us with that. So those are some definitions. Going into inflammation, we talked a lot about inflammation in the gut, and that's probably 98% of where we're seeing it. It's really a defensive immune response against foreign pathogens. So if you think in physiology terms, why do we have inflammation at all? It's to fight off infections. It's a huge tool for fighting off infections and repairing the body and maintaining homeostasis again, or balance. Reactive oxygen species can be made by polymorphonuclear cells, which are fancy terms for neutrophils, or the cells in our immune system that help fight bacteria often. They can promote endothelial dysfunction. Endothelial cells are the cells lining our blood vessels, like capillaries and arteries, and they're very sensitive to damage. Inflammation, usually we see oxidative burst in the macrophage normally. So how those macrophages, those cells of the immune system, those professional garbage cleaners, I like to think of them, how they kill infections and help keep our bodies healthy. They use reactive oxygen species. They use oxidative species, free radicals, to actually kill the bacteria. We see in neutrophils, if you ever wonder why pus is green-yellow, anybody ever wonder that? No? Well, I wondered it, I guess. Why is it green-yellow? Well, actually, neutrophils, when they're fighting bacteria and killing them, they generate hypochlorite ion, which is bleach. Bleach is kind of green-yellow, right? We're generating this stuff in our body to kill the infections, and wow, we use it externally too on surfaces. It's very interesting. So we do use oxidative bursts to kill bacteria, to kill viruses, so that they don't harm us. And then nitric oxide, another role in inflammation. Furchtgott was probably the first one to describe nitric oxide. He called it by another name because he found it a powerful vasoconstrictor for cells and vasodilator in his research. And he found a role for nitric oxide in inflammation to decrease it. So over here on the other side, just in the diagram. So this is how you can generate some of these free radicals. And also we have systems in place like catalase to get rid of these free radicals and turn them into water, for example. The Fenton reaction, we talked a little bit about that with IV vitamin C, interestingly. So your iron or copper can combine with oxygen and generate these hydroxyl radicals, which are very powerful in the body. This is, again, how the immune system is working to kill infections. And isn't it interesting we're generating that when we're giving vitamin C at high doses? Are we really treating infections? Are we really treating infections in cancer? Are we really treating infections in the gut? And if our microbiome is disturbed, of course we'll have more infections. I want you to think along the infectious disease pathway with patients when you're seeing diseases, because that's how the physiology is working, and I think that's why many of our integrative therapies are working. So, other points about inflammation. Mitochondrial reactive oxygen species have been shown to regulate the cellular inflammasome. Inflammasome is the complex that activates inflammatory caspases and cytokines in the macrophages. So there's a role for free radicals to actually help the immune system as well. Again, not all free radicals are bad. Not all antioxidants are good. I want you to think of them as a balance. Oxidative stress regulates the adherence junctions and tight junctions between cells. Whoa, Dr. Taxman. So those junctions, how the cells are talking to each other, they're using nitric oxide, they're using hydroxyl radicals, they're using these things to communicate. These are communicators for the body. Believe it or not, even some of these gases. There's a society called the Molecular Hydrogen Foundation. I went to the SOPMED conference back in April, and it was a very good conference. And there were a couple speakers there. Tyler LeBaron, he was talking about molecular hydrogen in China. What they do is if you have a stroke, when you come to the ER, if you can swallow, they give you 1 to 2 liters of molecular hydrogen water because they're finding that the hydrogen can reduce the area of the stroke and repair tissue and reduce the penumbra. And it's a gas, but they're finding it's a more powerful antioxidant than even glutathione. So I think these reactive oxygen mediators, nitrogen mediators, free radicals, and gases, that's really where the literature is going and where we need to look as a next step for disease and helping cure disease. All right, so the tight junctions, we'll talk more about that too, but it's fascinating. And then detoxification. So have you thanked your local janitor lately, or do you know your trash man? Anybody? You should get to know them. I mean, really, nobody thinks of them, but they're the reason we stay healthy in our society too. Detoxification is very important. I know we haven't really touched on it, but I did want to touch on it, and it's really part of oxidative medicine. Oxidative medicine is how detoxification happens on a cellular level, but we have to take out the trash too. So toxins. We're exposed to so many toxins every day. Cigarette smoke, mercury, cadmium, lead, radiation, electromagnetic frequencies, and that's becoming more well known now. Mycotoxins from mold. Did you know that mycotoxins like ochratoxin can inhibit NRF2? It can block your antioxidant system. It can block your glutathione production. And I think this is one reason why our mold toxic patients are so sick and so difficult to get better. Their immune system's been kicked in the knees at a cellular level from protecting themselves from oxidative stress. So their body tries to generate free radicals to kill those molds off, and then they have no way to protect the rest of the cell from all of that free radical generation and oxidative stress. So we see cellular damage. Excitotoxins, pesticides, herbicides. I'll show you one slide about Roundup, but the glyphosate, there's so many studies now about glyphosate actually causing leaky gut, actually being a carcinogen. It's in our food supply. It's not allowed in other countries. And that's just one example, not to just pick on that, but it can cause increased intestinal permeability, or leaky gut as it's known. If you try to search the medical literature, increased intestinal permeability is what you should use as a search term, and you'll probably find a lot on leaky gut that way. Household cleaners, Tylenol, dry cleaning, benzpyrenes, phthalates, plastics, cookware. So I go through with my patients and try to reduce these as a part of detoxification. You definitely want to reduce your load. And then a little bit about detoxification. There are 3 phases. So it happens in all cells of the body, but especially in the liver. There's higher concentrations of these enzymes in the liver, also in the kidney to a certain extent. Liver and kidneys are 2 of your main detox organs. I tell patients we detox every day in our stool, in our urine, in our sweat, and our breath. So the GI tract and the stool takes most of that, and then if that's not working, the kidneys take the next load, and you'll start seeing patients peeing all the time. They're going, there's no UTI, there's no stones, there's no other problem. Why am I peeing all the time, doctor? Are you pooping? So it's important that those 2 systems are working. The sweat glands are also very valuable. If those 2 systems aren't working, sauna, there's a case for sauna. The patient needs to be prepared for that on a physiological level first. But in Finland, they think so highly of sauna that they build the sauna first, and then they build the house around the sauna because it's part of their culture to have that as a detox practice. If you look at other cultures, they're very wise. They have parasite cleanses 2 or 3 times a year. They have sauna or some type of heat in their culture. They have basic diets, like Dr. Taxman was talking about the blue zones. There's many elements. I think we need to get back to those things. But detoxification, the 3 phases. First phase are activation of these toxins so that we can start to stir them up and get them out of the body. And that's really done by the P450 enzymes. So these cytochrome P450 enzymes, if you try to look up phase 1, that's what you'll find in any pharmacology textbook as well. There's many of them, and I'll show you an example later. Some help get rid of estrogen. Like CYP451B1 is involved in the estrogen pathways. Usually I'll see polymorphisms in that in patients with breast cancer. So their detoxification system for estrogen mediators is a little weaker than others. 3A4 is one you should probably know, and if you prescribed any drugs at any point in your career, you probably encountered that one. That's responsible for 50 to 70% of metabolism of all prescription medications in the liver. So these P450 enzymes have a place, but they generate reactive oxygen species, when you know. So even for detoxification, we're producing reactive oxygen species and free radicals. We have to have that antioxidant system, that NRF2 system in place to protect us during detox. Phase 2 is mobilization. So this is where we, once the toxins are kind of activated, we have to make them more water soluble to get them out of the body. So we stick groups on the toxins like glutathione, like sulfur groups. Glycine is very important. Glycine is the smallest amino acid and helps tremendously in detoxification pathways. Methylation. Methylation is involved in detoxification by making these toxins more water soluble for elimination. And acetylation. Kombucha, which was mentioned. Kombucha, the bacteria actually produce glucuronic acid. It's helping phase 2 detoxification. And then we have elimination. This, I think, is probably the most important piece, because when this gets backed up, the whole thing gets backed up. And we end up with cells full of garbage piled from floor to ceiling. And that's usually, the patients are coming to see us at that time. So elimination involves these MDR antiporters, which were named multi-drug resistance antiporters by the pharmacologists. But their job is to remove toxins out of the cells. They do this by placing it in the gut lumen directly into the stomach and gut lumen, which is, again, one reason I think we have so much inflammation in the GI tract, because the body's always trying to clean itself too, and then directly into portal circulation in the liver. But imagine if the trash man never took out the trash and there were no doors in this place and we were in here for years, it would build up, right? So if phase 3 isn't open, if the intestinal tract isn't open, if your patient isn't having at least 2 well-formed bowel movements a day, it's all going to back up. And guess what? Phase 1 doesn't stop. So you're going to keep generating these reactive oxygen species, and you can't get them all the way out. So of course you're going to age. Of course you're going to feel bad. Of course you're going to have joint pain. We've got to eliminate. So 2 soft form bowel movements a day. Everybody needs that. If you're not getting there, magnesium can help. Lots of things can help. Hydration, fiber, diet change. But that's very important because we'll actually age faster without it. So elimination. Okay. I wanted to show you just a couple different pictures of the liver so you get an idea of how some of these nutrients in orthomolecular medicine are important for detoxification. You've got endotoxins, so the end products of metabolism, and bacterial endotoxins, for example, at the top there. Then you have all the other exotoxins we talked about on that slide, agricultural, food additives, pollutants. They're nonpolar, they tend to be lipid soluble, which is why toxins like to depot or store in fat tissue, bone marrow, for that reason, because they're not water soluble. Detoxification is all about making them water soluble to get them out. So what we do again is we take them through phase 1. We need enzymes, cofactors, the B vitamins, especially B6, very helpful for that, folate, B12, and if they can't methylate, methyl B12, especially methylfolate. Glutathione, which is made from your glycine and your cysteine amino acids and some other things, the branched-chain amino acids, your phospholipids, and then we take them through, again, phase 2 conjugation. We stick these groups on them to make them more water soluble. Again, amino acids, glycine, taurine, glutamine, ornithine, arginine, methylation. So you need these raw ingredients in the body, and when they're missing from the soil and the food, there is a case for measuring them in the body and replacing them. Ideally, we need to be replacing them in the soil and the environment in our food supply. That's how to do it on a mass scale. Plant a tree. Just like our speaker yesterday said, the trees have it figured out. It's true. We need to take care of our air quality, our water, our soil. If we did that, we wouldn't need as many supplements. And we could get it from the food. So anyway, phase 2, and then phase 3 is out of the liver. Now you also need the bile system working. Without the bile system working, the liver makes bile, but it goes to the gallbladder. If that gallbladder has stones, if it's blocked, that's a problem. You need to take out the trash. And instead of just removing everybody's gallbladders for cholecystitis, we need to be helping the gallbladder regularly. There are foods that are good for the gallbladder. Beets are very helpful. They contain betaine too, which is helpful for stomach acid. Artichokes, dandelion greens, very helpful for gallbladder in the diet. There are other things, phosphatidylcholine. Phosphatidylcholine is wonderful for the brain, for the bile system, for the liver. Trying to think what else, B vitamin support, but those are a few. Taurine you need to make bile. And there's something called enterohepatic recirculation. So what that means is the bile is very expensive to make for the body, and so it will save it and recycle it. And toxins can recycle in that bile. So we need to break the enterohepatic recirculation when patients are sick and replace the bad with the good. And there are ways to do that, but the first is to open up their bowels, open up their bowels, open up their bowels. Okay, so this is just another view, easier to read, but again, you need multiple nutrients to do detoxification. Coenzyme Q10 as well. And then also, I think this is exciting, something I learned at SOPMed too. Reactive oxygen species and nitrogen species are involved in communication. And communication is occurring all the time in our body. Our body really functions as one unit. This is a really nice paper describing how the mitochondria talk with our microbiome. Wow, mitochondria can be targeted by microbiota to modulate interaction with the host. So nitric oxide, hydroxyl radicals, these free radicals and these reactive oxygen and nitrogen species are the language and the communication between our cells and the outside world and our microbiome. And if you think about it, the microbiome should be making us vitamins. That microbiome should be making us short-chain fatty acids to protect the colon from cancer, all of those things that Dr. Taxman mentioned as well. So patients with mitochondrial diseases are more prone to bacterial infection, interestingly enough. Those inborn errors of metabolism in mitochondria, we see more bacterial infections in those patients. Modulation of the diet can induce variation in mitochondrial functions associated with the modification of quality and diversity of the microbiota. So basically, what you eat can affect your microbiome, can affect your mitochondria, and the cellular health as well. Also, if there's an imbalance between the bacterial species and dysbiosis in the intestinal tract or the stomach or even the mouth, then we can see increase in reactive oxygen species in the mitochondria and more inflammation. So I want you to think more free radicals. If it's getting out of hand and we don't have that antioxidant system to counter it, we get more inflammation. Based on current available data, bacterial species can also trigger insertion of bacterial or mitochondrial DNA within the host genome and induce mutation of somatic cells independent of mitochondria. So what this is saying is, if there is inflammation going on, if there are bacteria present that are harmful, they can actually insert DNA into our host DNA. So it provides a mechanism for oncogenesis and tumor formation and other pathologies as well. So this communication is very important. That microbiome is very important, and in research, we haven't studied it. We haven't studied any of our research taking that into account. It's been in sterile environments. Again, this is another paper describing that crosstalk between mitochondria and our microbiome, using those free radicals, using those reactive oxygen species as the communication link. And again, another paper showing symbiosis. So very interesting how those two are connected. Clinical applications, what we try to do at the Riordan Clinic and in general is, find root causes, and some of the ways we do that are to look for deficiency states, to look for toxicity, to look for infections and inflammation. I think that's really, if you had to summarize in a few brief words what this medicine is trying to get at, those are the areas that tend to be overlooked. Dr. Levy talked about the mouth, looking for infections in the mouth. We've seen that over and over in the presentations as well. So toxicity, inflammation, deficiencies, breakdown of cellular communication start with the GI tract. 2/3 of the immune system is in the GI tract. How wonderful, we can access it, right? We can change it. 3/4 of our neurotransmitters are in our GI tract. That's 3/4 of our brain chemistry in our GI tract, not in our brain and spinal cord. 70% of the serotonin you make is in the GI tract. You want to talk about links to depression and gut health? I mean, it's pretty clear that the elements are there. Mechanism of increased intestinal permeability and autoimmunity, inflammation, and increased toxicity. I want you to take this point home. Chronic inflammation is a loss of communication. Chronic inflammation is a loss of communication between the cells. That's why it's so harmful. It's a loss of communication. Think of it this way. The cells should have tight junctions. They should have connections, so they're always together, speaking with each other. One knows where the other is, just like you and your neighbor in a small village, and your community. So if one's hurt, the others know that it's hurt, and they will try to come and heal it. If the communication is severed, what you have is one cell that's disconnected from the rest. The rest of the community doesn't know that that one's hurt. It can't get it help. So the cell starts to lose hope. It starts to change its metabolism from aerobic to anaerobic, and you start to get tumor formation. It's a community on a micro level and on a macro level. Think of society. You have somebody who's delinquent, a teenager, they start to get into drugs, they start to get into alcohol, they go to jail, they're locked up, they're separated from community. They're really probably deficient and infected, by the way, but Pfeiffer did some of that work too. But what you see is that, kind of evil, or that the illness separating each other on a cellular level and on a macro level, separating us. And what we need is to come back together to heal. So keep that in mind. That's really what the literature is showing, which is interesting on a cellular level. Chronic inflammation is loss of communication. And that's not my concept. I learned that from Zach Bush. He's an integrative endocrinologist, I think in the Virginia area. I don't know if any of you know of him. You do. He's interesting. He seems like a pretty honest person. He did research in cancer and then discovered lignites. Lignites are kind of a form of coal, carbon-based compounds that naturally should be occurring in our soil and in our food supply, and they're no longer there. So he developed a product called Restore, which is a lignite extract. It's a liquid that's taken before meals, and in studies it's been shown to seal leaky gut. Seal leaky gut. Seal it. You can see the zonulins and occlusions junctions come back together again. In many populations, it's been having good effects for chronic inflammation, bowel problems, ADHD, autism. I think there's more than just leaky gut. I think there are infections in the gut too, but he had a paper come out not too long ago that I have, if anybody's interested, describing how it's working. It's called Protection Against Gluten-Mediated Tight Junction Injury with a Novel Lignite Extract. So that's not my knowledge. I learned it from him, but I do think it's important, and the literature is showing it as well. Again, when we talk about increased intestinal permeability, just realizing the pesticide use, I find it interesting. This is one in our supply pretty frequently. If you look at the mechanism of action of glyphosate, it's designed to implode the intestinal tracts of insects. What are we seeing on a population level? Intestinal tract damage. It's imploding our intestinal tracts. So really cleaning up our food supply, these are much bigger levels than doctor-patient. This is a system level, and I think that's probably why Linus Pauling got involved in the peace movement, because if after a while, if you're a doctor and you start to think bigger and bigger, I was discussing this with my physician's assistant, Jeff, yesterday. It's kind of depressing. We have to take all these supplements all the time just to live. Why? It's our air and our water and our soil. We need to work on those. Because for our children and our children's children, if these are epigenetic phenomena and they're not going away because of the load of toxicity, we can protect ourselves with these vitamins and minerals and charcoal and clay to bind toxins, but we still have to clean up our world. So just to show you, it's pretty significant, the use of pesticides over time. And there is a project, I had read about it. It's not underway yet because of the overwhelming response, but there is a project that's going to be coming soon where anyone can send in samples of urine or blood and have glyphosate levels checked, and they're going to keep a registry going. So keep your eyes out for that. So testing. We do testing in the Riordan Clinic pretty routinely to try and get to root causes. I think it is helpful. When I was in medical school, the first year I asked the question, as we were learning about the GI tract, so why aren't we allergic to all of our food? Why aren't we having antibody production to our food? And I was told it doesn't happen. And then sure enough, I learned it does, and there's tests that show it. So again, if that increased intestinal permeability or leaky gut is going on, you have a mechanism of how these antigens from anything, including our food, could stimulate the lymphocytes and other immune tissue in the GI tract where 2/3 of the immune system is, and generate inflammatory responses. So this is just an example of some of you have done testing or you're interested but haven't seen a panel. This is a typical panel that we might get on a patient. So we have a number of different foods and levels of reactivity. There's different tests for food sensitivities. This is a cytotoxic-based assay, so we're looking at cells in real time, the white cells in particular, and if they're going after the food and causing inflammation and rouleau formation, and et cetera. A technician grades these by hand. Sharon, she's a good one. She's been with us a long time. But levels of reaction, so 4 is the highest. So this patient, pineapple was significant, definitely. Level 2 or level 3 definitely need to be rotated out of diet for at least a couple months, and the gut healed. And then we also measure nutrients. I tell patients when I sit down and go over a lab panel with them, I consider these nutrient reference ranges like a gas tank, and probably they're very low because they were developed in the 50s for a reference population with no acute or chronic disease. The reference population, no acute or chronic disease, that's no one we're treating now and no one we're testing. So the reference ranges really need to be updated. But regardless, I consider them a gas tank, I tell them. So I at least want to see you 50% on your gas tank. I don't want you running around town on fumes. I'd rather have you on the higher end for some of these nutrients. So we take them through a panel. Vitamin A, your orange veggies, it's a great time of year for those. Vitamin E, seeds and nuts are a good source. Your antioxidant colors in those veggies, beta-carotene, lutein, lycopene, your orange, yellow, and red. Vitamin C, we check in the plasma and the urine. B12 level is pretty low here. I like to see that closer to 1,000. D was low. Dr. McCarthy, help. We need some help for this one. Folate, CoQ10, your B vitamins. Let's see. Other B vitamins. The amino acids are very interesting, especially when we check neurotransmitters with them in the urine. I like to get the amino acids if somebody's having trouble sleeping, insomnia. Usually I'll check their urinary neurotransmitter profile too and find correlations. They're low in the amino acids and low in their neurotransmitters. So instead of prescribing SSRIs and making the serotonin last longer in the synapse, why not help them make more serotonin? That's kind of the approach. So some of these amino acids are very important in metabolism. All of them are, but for example, tryptophan, you need that for your serotonin pathway. Tyrosine, you need that to make your own thyroid hormone if that's too low. Methionine in the methylation cycle is important. Lysine for viral infections, very important. Occasionally we'll pick up inborn errors of metabolism too. I've seen a couple of these. So the amino acids can tell you about that. Not every state tests for inborn errors of metabolism to the extent that other states do. Kansas only used to test for a handful, and that was one good thing that came out of our medical school class. We petitioned and made them test for more so we would know on birth. Thyroid function, this patient, T3 is towards the lower end. Reverse T3, usually reverse T3 will go up with inflammation typically, but T4 was on the lower end, so probably thyroid system not functioning optimally. The fatty acids are very helpful as well. These, we need essential fats. The two essential fats are alpha-linolenic and linoleic acid. Those two you can't make in your body. You have to get from your diet. You can make the rest of fats from those two. but those need to be high enough. Some people have a hard time making some of the downstream fats from those two. For example, the alpha-linolenic, that's your omega-3 family from plants, like your chia, walnuts, flax. That gets converted to your DHA and EPA, but that conversion in some people, that enzyme system is weak, so you need to supplement them with direct EPA, DHA. So we get some fatty acids, and there's a lot to do with inflammation there, arachidonic and such. Basic cholesterol panels, we look at that. G6PD, I like to check G6PD on everybody, just a safety check. Not everybody does that, and that's okay. I think if we use higher doses of vitamin C, you should know that you need a G6PD. Like if you're going 25 grams or higher, I would highly recommend that you check one. There have just been a couple cases in the literature, not many at all over at least 50 years of practice, but there is a risk if someone is severely G6PD deficient, if you give them any highly pro-oxidative therapy, whether it be fava beans or fluoroquinolones or high-dose IV vitamin C, there's a risk for hemolysis where the red cells can burst open, hemolytic anemia, and renal failure. So I think you need to know that to check a G6PD if you're considering high-dose IV vitamin C, 25 grams or higher. Homocysteine, high sensitivity CRP, very helpful to monitor that, and you can see quite a lot of inflammation going on. And then we can also check the genes. I think these are interesting if you're looking at detoxification pathways. The cytochrome P450s, you can actually look for SNPs in people. There are many companies that do this, many ways to do this. I'm just showing you one example. But again, this patient has a change in 1B1, which clears nitrates, charbroiled meats, estrogens. COMT is one of the methylation genes. Sometimes we'll see that SNP and anxiety, depression pop up quite a bit. Acetylation, helpful for anesthesia and choosing an anesthetic for people if they're going to undergo major surgery. That's nice to have. Glutathione genes can tell you their reserves to somewhat the extent that they can manufacture these things through NRF2. And then SOD, superoxide dismutase, gets rid of some of these free radicals and antioxidant system for us. So, yeah, that's kind of the majority. I wanted to leave a couple minutes for questions if you have anything, and give you enough time for the break. I want to stay on time for you. So thank you for having me. Nice to be with you. It's a good question. Traditionally, we've only done one check. I think Dr. Ola saw this. I've seen it a couple times where I've checked it periodically, maybe once every 6 months to a year. I have seen it change mildly, but I haven't seen it change so much that somebody goes from being G6PD normal to deficient. I haven't seen that happen. But I think it is interesting, and in our vitamin C research, I think it's interesting to monitor that because it could affect dose and frequency of therapy. Oh, the lignite source, it's a supplement called Restore. The website is restoreforlife.com, but it's just called Restore. It's from an integrative endocrinologist, Zachary Bush, MD. He's boarded in internal medicine and palliative care, but he's used it in children and adults for years safely, and he's had some data to prove it too, and he just published a paper. But I've tried that with patients. We have it in the clinic. I haven't used it long enough, but I have seen some improvement in GI function pretty quickly.